All right. So how do we get started here, Cecilia?
Okay, so first we are going to start with the first heat, and we have WFAPS, that it's the World Federation of Associations of Pediatric Surgeons. We have also IPEC, the International Pediatric Endosurgery Group, and the Ibero-Americana Society of Pediatric Surgeons. So for the first presenter of the day, we have Dr. Shilpa Sharma. She is a professor in pediatric surgery from the Department of Pediatric Surgery on All India Institute of Medical Sciences, and she brought us today the exploring alternative pathways of stem cell proliferation for hepatic regeneration by partial liver resection in extrahepatic biliary atresia. So let's hear it.
Greetings from India. Today, I'll talk about exploring an alternative pathway of stem cell proliferation for hepatic regeneration by partial liver resection in extrahepatic biliary atresia. Biliary atresia is a dreadful disease with no definite cure. We all know there is progressive cholangiopathy that leads to morbidity and also end-stage cirrhosis. In a developing country like ours, with delayed presentation, advanced cirrhosis and hepatic failure, most infants succumb to hepatopulmonary syndrome, portal hypertension, intraventricular hemorrhage, and even aspiration due to massive ascites. The liver may regenerate after physiological insults and resection. Hepatic resection acts as a trigger for this regeneration. The liver, however, can regenerate only to a size that is proportional to its original size. Hepatocyte recovery is affected by many factors. When there is biliary atresia, the hepatic stellate cell comes into action and leads to the pro-fibrogenetic pathway. Here, the involved cytokines include transforming growth factor, platelet-derived growth factor, and interleukins. When there is hepatic resection, the hematopoietic stem cell come into play and lead to proliferation with the help of hepatocyte growth factor receptor, epidermal growth factor receptor, and several cytokines like tumor necrosis factor. In 2015, we started resecting a part of the liver, segment 2 and 3, to stimulate an alternative pathway of stem cell proliferation for hepatic regeneration. Here we can see the markings on the liver of segment 2 and 3 in a non-anatomical fashion. We propose to examine whether this segmentectomy could curtail or reverse the ongoing damage when combined with a routine Kasai procedure, and compare the results with those cases in which only Kasai had been done. After ethical permission, we divided the cases into two groups and compared the preoperative day 7, 1st, 3rd, 6th, and 12th month bilirubin and APRI in both the groups. Statistical analysis was done. The median age at presentation was similar in both the groups, being 96 and 89. We had more number of females in group A. The serum bilirubin levels was significantly different between both the groups at 1 month and 3 month postoperative period. The APRI was significantly different on day 7. The mortality was lower in the study group compared to the control group, that is 56% is to 93%. The jaundice-free percentage was 91% in the study group compared to only 25% in the control group. To conclude, resection of a part of the liver may trigger an alternative path of stem cell proliferation for hepatic regeneration with reduced fibrosis and improved survival. Thank you for patient listening.
Okay, so unfortunately, Dr. Sharma is not here with us today, but I'm really grateful for her presentation. So we get to move to the second one.
Wait, can I ask a question now, or do I have to wait till later, Cecilia? I know there's no one to answer it. I just want to make sure I'm getting this right. I mean, these were drastic differences, that the mortality was almost half.
Yes.
Just by resecting a piece of the liver. I don't know if the two groups were exactly the same, or was it totally randomized? Because that's a drastic difference in mortality. And how did they know how much liver to resect? This seems to me like there's something I'm not getting, because this seems like one of the most groundbreaking discoveries we've seen in a long time. So there's probably something about this of why it's not all over everywhere now.
I think like, yeah, they resected, they decided to resect, I think, like it's mandatory, that part, because they study to resect the left liver so that they can leave enough to regenerate. And they did this because they got patients like really late, after 80 days of life. So that's why they decided. I was hoping she could answer, like, if it is younger, should we do the same thing? But yeah, the results are drastic.
Yeah. All right, thank you.